So today we'll be talking about a very interesting HRCT chest. Now this is high resolution CT scan of the chest. Whenever we will call it as high resolution, it doesn't mean that the contrast is used. This is a very common confusion part. Whenever someone says that HRCT has to be done, everyone thinks that contrast is used. No, HRCT means there is no contrast is compulsorily. This is without contrast film. So what we can see in this city is when we zoom in, we can see that there are white patches in both side of the lungs. Now this is left side and this is right side. Starting from the upper apical lung area, you can see there are white patches. So there are white patches which are starting from right apical portion of the lungs, that is from upper lung portion, and this is the lowermost portion where you can see this is liver and this is spleen. So we are entering into abdomen now. This is liver, this is heart, this is heart shadow. So here the heart shadow is almost gone. It means we are entering into the abdomen. This is all abdominal fat, this black. This is spleen, this is liver. So we are entering into abdomen. So this here also, this is the lowest most part of the right lung, and here also we can see this, there is a white patch. So this is very typical of lung pneumonia or consolidation. Now we can see that each and every field, these white patches are there. So these white patches are there which suggest pneumonia. So here pneumonia is dense white uh, patch in the lung parenchyma, and you can see the air bronchogram. Air bronchogram means there will be a patent bronchus, and that will show an air which will appear black. So presence of air in patent bronchus is called air bronchogram, which will tell that it is a pneumonia. It is a pneumonia. So in this city, we don't have very beautiful air bronchogram. You can see here that this this black is all air, and this is actually a patent bronchus. So this is a consolidation patch. So these are all consolidation patch. Now the beauty of this CT scan is the maximum lesions are all lined in subpleural area or in peripheral area. What do I mean is this is more of a central part of the lung, and this is more of a peripheral part of the lung. So when you see each and every lesion is almost starting at a subpleural area. So you can see this is the end of lung, and you are having patch here. You are having patch here. We can see that this is rib. This is dense white is rib. So just above the rib, just adjacent to rib, you are having these lesions. This is rib. So just above the rib, you are having patch. This is the rib. So just above the rib, you are having this patch. 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 So you can see that this portion of lung compared to has much lesser lesion compared to outer part of the lung. So this is predominantly subpleural patchy involvement, and by default, subpleural patchy involvement with consolidation is highly suggestive of COVID-19. Is highly suggestive. So subpleural patchy involvement in bilateral lower lung field, that too extensive, involving both upper lung fields, middle lung fields, posterior lung fields, lower lung fields, is highly suggestive of COVID-19. So COVID-19 will show you dense white patches which are consolidations. So this is dense white patch. This is dense white patch which is consolidation, which tells us that there is extensive involvement of alveoli, interstitium. There is significant amount of exudate present in the alveoli. It is significantly involving interstitium. That is the reason why this dense patch has developed. Apart from this dense patch, the other typical finding of COVID-19 is GGO, that is ground glass opacities. Now, what is ground glass opacity is when we compare this dense white consolidation patch, which are very much white, GGO are lighter lesion. These are more of a lighter lesion. Now, why does this lighter means they will be light white or light white patches. So you can see here. So this is also a patch, but it is very light. Compare the radiolucency to this lesion or this lesion or this lesion. This looks much more faint white compared to the dense white consolidation which is here. This is because this is one of the early lesion. In the early lesion, basically, whenever this lung involvement starts, there is initial involvement of the alveoli, there is initial involvement of interstitium. So, because of this infiltration of alveoli interstitium, in initial phase, you get such faint white patches which are kind of uniform, and these are called GGO, like ground glass opacities. Ground glass opacities, you can simply come to know whenever you have a mirror or a glass. If you rub that glass by any firm thing, like a stone, you can get a pattern, and that pattern is called ground glass opacities. So presence of lighter white patches, that is GGO, and presence of this subpleural typical patchy consolidation involving bilateral upper, middle, or lower lung fields is highly suggestive of COVID-19. So this is actually basically Hrct chest film of COVID-19, and it is one of the very typical findings. Similar findings can be seen even in influenza virus also, but this is very highly suggestive of COVID-19, and COVID-19 RT-PCR has to be done, must be done, and should be treated accordingly. So thanks for this video to all of you.